Good day, everyone. I'm Dr. Bevin. I head the emergency department at Sakra World Hospital. Yeah, staffing shortage is a real problem. There aren't enough people to take care of the total burden which is actually presenting to the hospitals. That is true. So some of the ways you can handle this, you see, if it's a perennial problem, we have to have some sort of a strategy for it. So first of all, what happens is to manage with what you have. One thing, as a head of a department, one of my jobs would be to make sure that there is an intelligent roster, which is like making sure that you have the appropriate resources and you're able to use that resource in the best way possible without actually, tiring out that resource completely. So I would say intelligent rostering is one of the first things that we should think of doing when we have something working, when you have a fixed amount of manpower. Then you have to consider factors of lean management. So now you have to understand what is it that a person is able to do, what are the things that we need not do, what are the things that we need to. For that, a pure understanding, a proper understanding of the process is required. So when you have a better understanding of the process of what it is, it needs to be studied, mind you. You have to do often audits and understand how it is working. Initially, when you start with, you might decide to push in a little bit of manpower, and before you want to cut down that manpower, you would like to understand the phenomenon and then try to streamline that phenomenon in such a way that that manpower can function adequately within that particular plan. It's a good thing that emergency has a lot of predefined protocols, because predefined protocols help you already understand what is the kind of manpower that you might need for a particular action. Like, for example, a resuscitation. When you're doing a resuscitation, you know you need somebody to do chest compression, somebody to handle the airway, you need somebody to keep record of what is going on, someone to handle the drugs, someone to give a shock, and one person to lead the code. So you know what you need for those phenomena. So you actually adequately plan for such things and make sure that number of staff is always available. So we have to understand the entire bell-shaped curve here, like as to how your patients come. So some will come in a very extreme, some will come in a very, very mild form, some will come extreme. And the large chunk of them will stay within that particular statistical, standard deviation, so to speak. So in that, we'll have to kind of understand whether this approach will work for all or not, and for when to apply a particular approach. So there is a little bit of customization that is always required in healthcare. There is no substitute for contingency planning. You have to plan your contingencies. You got to know which are the seasons wherein you might have the maximum burden, which is the season where you might actually be in a better position to give people vacations. So like there will be times wherein the footfall will change depending on your population around your particular area that you live in. There will be changes. Some variations will be there. Some seasons, example, rainy season and dengue. That time you need a lot of hands on deck, because there is a lot of dengue burden which is adding on to the existing disease burden. So like that, you have to understand what is being brought to your healthcare scenario, and you have to adequately plan your manpower and adequately plan the responses.